This is Tom Lee, Editor-in-Chief of NEJM Catalyst, and the topic today is leading organizations through transformation. Our conversation is with Dr. Pratibha Varkey, who is the president of the Mayo Clinic Health System, as well as professor of medicine and professor of preventive medicine at Mayo College of Medicine and Sciences. I will say at the outset that she's an extraordinary physician executive who I've known for several years now. She has been a transformational leader, and I use that word with care. And she spent the majority of her career at Mayo Clinic, but has also served as the CEO of the Seton Clinical Enterprise in Central Texas and the CEO of Yale New Haven Health Northeast Medical Group in Connecticut. Now, all of those organizations have great strengths, but every organization in healthcare needs to be changing all the time, growing, and responding to the challenges that are appearing constantly for healthcare. As a result, they and virtually every other organization I know of in healthcare is in the midst of transformation nationally. So we're grateful that she is here to talk about the nature of transformation and the nature of leading transformation today. So Pratibha, can you start by telling us more about the Mayo Clinic Health System? And then we can get to the nature of transformation that's underway there.
Tom, I'll begin by saying thank you for inviting me to be on this podcast today. Mayo Clinic Health System is the community branch of Mayo Clinic. We are home to 14,000 incredible employees in Minnesota and Wisconsin, with a small presence in Iowa. We serve about 600,000 unique patients each year through 16 hospitals and over 30 multi-specialty clinics. And I'll say we typically see upward of 1.2 million outpatient visits a year and take deep pride in providing Mayo Clinic care close to home.
So what is the nature of the work of transformation at Mayo Clinic Health System? Like, what's the need and how did you start to go about it?
So, Tom, as you know, at the root of most transformation and the need to be sustainable transformation, there is a need for strategic, operational, clinical, and cultural transformation. And those are the various elements we've been working on. As a first step, developing and sharing the strategy, unifying and motivating teams was critical, as it is a rallying cry to work together, inspire confidence, and create the urgency to change. As a team, we also spent significant time getting the organizational structure right and the right leaders in place and empowered to lead us to 2030. This included, for example, investment in a new team focused on population and value-based care, as well as a new team focused on digital and AI innovation. The third was to create systemness, a steady and disciplined focus on integration across the different regions and sites as we are so spread out, and simultaneously creating a seamless, integrated virtual and physical experience to help our patients was core to the transformation journey. In this vein, rather than functioning as 16 hospitals, we now function as one hospital with 16 doors and have a very integrated AI-enabled, dynamic, centralized hospital command center, for example, that is able to triage patients to the right hospitals based on distance, acuity of the patient, staffing needs, and bed availability. It's really transformed the practice. Investing in our staff in various ways, including in education as well as leadership and team development, while also enhancing workflows through AI and automation, has also been instrumental to continue transformation. Also important was spending time to really understand our customers, our patients, and their needs, particularly given our aging and rural communities. And this really helped us shape our ambulatory, inpatient, and surgical service line strategy with operational discipline. Finally, sharing many of these learnings with other institutions through our annual Community and Rural Health Symposium, where we bring in 300 to 400 healthcare experts from across the country in the fall every year, has been something that leaves us continuously inspired to do more.
You sound like a clinician breaking down a problem, and I'm sure that's kind of the way you approach this work. I also was very struck by that comment you made about thinking of yourself as one organization with 16 different doors. That is something I haven't heard before, but it's certainly it's a powerful image. Now, those doors are really far apart in your region of the country. What are the unique challenges that rural communities face, and are there key tactics that can be helpful for other leaders leading transformation, both in rural communities, but other settings as well?
That's a great question, Tom. As you know, 1 in 5 Americans live in rural America, and zip code is often and unfortunately a better predictor of outcomes than many traditional healthcare indicators. So, truly, in seeking to transform healthcare, it will be critical not to leave our rural communities behind. More than 90% of the communities we serve in Mayo Clinic Health System are rural. And so, understanding issues unique to our rural communities, as well as thoughtfully addressing them, have been critical to us. I'll start by sharing some of the key issues that I think are unique to most rural communities. Workforce shortages, an aging population, increasing complexity of diseases prompting need for more complex care that is often inaccessible. Financial sustainability, you know that many rural hospitals unfortunately are in the midst of closure. Aging healthcare providers in these communities and difficulty recruiting new providers to smaller communities are many of the challenges facing rural communities across the US. At a time when we are deeply invested in digital first solutions, it is also critical to understand that many rural communities across America do not have broadband access. So let me share a couple of lessons learned from our journey in Mayo Clinic Health System. The first is that rural communities are a wonderful place to live and work. The commute is often easy, neighbors deeply care about each other, are passionate about the community, and the quality of life can be outstanding. As we think of some of the challenges facing rural communities, pivoting them to opportunities to rethink the care model, I think, are abundant. And I'll touch on 3 examples. The first is providing the right level of care at the right location and integrating that care between the hub and critical access hospitals or perhaps smaller clinics is critical, particularly in specialties like OB, where there's a national shortage of physicians, and there are plenty of maternity deserts, unfortunately, across the US. It also creates an opportunity to serve patients locally in rural towns while creating a nidus of experts for more complex care where local patients need to be seen, for example, for a delivery. The second is a digital first strategy, including a strategy considering what we call care beyond walls, is going to be very critical and important to democratize access in rural communities. For example, to keep up with the demand of primary care in communities where we are the sole provider, we introduced a couple of years ago a 24/7 app called Primary Care on Demand that supplements in-person care. What was especially notable was that a third of the patients that accessed the service did so in evening and weekend hours, which of course would have otherwise resulted in visits to the emergency room. We have also introduced digital pathology across Mayo Clinic Health System, part of a Mayo Clinic Enterprise initiative, and several population-based initiatives like mailed colon cancer screening tests to tens of thousands of patients, virtual management of complex chronic conditions, as well as hospital-at-home services and mobile clinics that provide outreach to communities with limited access to primary and specialty care. And finally, I can't emphasize enough the need for workforce transformation through partnerships and early mentoring of students from local community colleges, in addition to universities. That has been critical to recruitment of allied health colleagues like our OR, surgical, and rad technicians, as they are typically from the communities we serve and are enthused about continuing to contribute to these communities as they move into the workforce. Our family medicine residency programs as well, for example, retain over 75% of the graduates that we train, really contributing again to that workforce transformation within the spaces that they are mentored in.
Well, many of the things that you just cited successfully made me jealous. But I also know that as a doctor, I don't really like the idea of transformation. 24 hours from now, I'll be seeing my patients, and I basically want to be doing the same things I was doing the same way 20 years ago. So how do you take on that challenge of cultural transformation when clinicians are just basically are hardworking people who want to be let to do what they believe to be right, and and want to be left alone? How are you shepherding them through this kind of change?
I agree with you, Tom. Change is tough, and I think paying respect to that and really understanding that at the end of the day, change management and transformation is really led and delivered by people. So if we don't pay adequate attention to the people side of change and only focus on the technical aspects of change, I think it will be very difficult to create sustainable transformation in the long run. And of course, as leaders, we can't do it alone. There is a wide breadth of leaders across our systems and our enterprises. And so supporting and providing tools and investing in our frontline supervisors, our site directors, our chairs, our staff in their own growth, in leadership development, in investing in tools for well-being as they deliver and lead change has also become very critical to sustain the transformation journey. With bold transformation, leaders also often have to move fast. And so, as importantly, they also have to stay connected to the people. So, three principles that have guided us during times of tremendous change that have become critical for us that I'd like to share are communicating early and often. And that includes when answers are not clear. And so I began by saying sharing a strategy is a great unifying force. And so sharing that vision transparently and often is going to be very critical so that people understand the why behind the change. The second is to continuously be visible, even in times of busyness, because leadership presence really matters, particularly when decisions are going to be hard and change is going to be tough. So whether it's in frequent rounding, in safety huddles, in town halls, or in direct conversations, truly help with building credibility. And I've personally found that small group listening sessions are incredibly helpful and very grounding because it's really bi-directional conversations. You hear about what's not working well on the ground, you hear about creative ideas. And you'll also hear about questions related to the change that is being deployed that gives you an opportunity to explain and translate again to the front line. Visual management boards are another great tool to problem solve and efficiently and effectively communicate change and also address pending issues that have not been closed yet. And finally, continuously reinforcing that shared purpose that I talked about, reminding teams of the why the work matters for our communities, for our patients, for each other, keeps people grounded when change feels disruptive.
Well, I'm sure for many of the physicians in the Mayo Clinic Health System, a major attraction to being part of the system is the Mayo Clinic's values. The needs of the patient comes first. But on a day-to-day basis, they're probably more engrossed by Mayo being on the forefront of the digital transformation, and particularly regarding the use of AI in healthcare. So how has work going on at the mothership been leading to patient care changes in the health system? And are there key lessons to learn as innovation in AI is rolled out to community-based networks?
Tom, this journey actually began ahead of the pandemic under the leadership of our CEO, Dr. Gianrico Ferrugia, where we launched the Center for Digital Health, and the Mayo Clinic platform. And currently, we have more than 300 AI projects led by our staff across Mayo Clinic in various stages of maturity, from vetting for feasibility to building algorithms and models to those that have been clinically implemented and truly transformed our practice. Whether it is in selecting and matching patients with the most promising clinical trials, or deploying and developing remote health monitoring devices, or leveraging imaging technology to anticipate disease years in advance of symptoms. We've done that with pancreatic cancer, for example, or digital pathology that has transformed the practice across Mayo Clinic. We have incredible promise with AI influencing the transformation of healthcare. And perhaps I'll share 3 snapshots from Mayo Clinic Health System in terms of the actual impact on practice transformation. Of course, this is the result of tremendous leadership from many clinicians and physicians and teams under the leadership of Dr. Rajiv Chaudhry, our AI Informatics Medical Director at Mayo Clinic Health System, that have led the change. The first is early during the pandemic, through the platform, we began the Advanced Care at Home program, which is our hospital at home program, piloting it first in Mayo Clinic, Florida, and Mayo Clinic Health System in Eau Claire, Wisconsin. So through this program, our patients have 24/7 access to Mayo Clinic providers and extensive remote patient monitoring while patients are admitted to the comfort of their homes. It's incredibly well-liked. Satisfaction rates are upwards of 95%. And what is interesting is that identification of appropriate admissions took upwards of 30 minutes, for example, of a nurse review, followed by discussion with the physician and subsequent admission for the patients. And approximately 1 out of 10 of our ED admissions were triaged to ACH. Fast forward 2 years, our team integrated a protocol-based AI model that automates the identification of eligible advanced care at home patients into the health record. And this increased enrollment overnight from 1 in 10 to 4 in 10 patients that approached the emergency department, and saved, for example, several thousands, tens of thousands of bed days each year. What was also interesting is a year ago, 2 neighboring non-Mayo hospitals abruptly closed their doors in Eau Claire, Wisconsin, without much notice. And a third of the town, unfortunately, suddenly lost access to healthcare. And it was wonderful, again, to have that expanded capacity for inpatients through the hospital at home program. The second is AI also helps in workforce transformation, and I'll give you a practical example. As we were emerging from the pandemic, there was a massive backlog of patients needing colon cancer screening. This was an issue across the country. We also simultaneously had a massive shortage of CRNAs and anesthesiologists, impacting the capacity to do colonoscopies. An AI-enabled program developed by one of our GI physicians, integrating an existing evidence-based protocol, marrying it with AI, created a significant improvement in triage of 30% of these patients, from needing complex anesthesia requiring CRNAs to nurse-assisted sedation. And this, again, immediately resulted in 150 additional colonoscopies per month done in Eau Claire alone. And as you can imagine, this has significantly changed the practice and improved access. And this protocol has subsequently been disseminated across the enterprise. The third example I'll talk about is ambient listening and documentation. It is very rare, as you know, to hear physicians excited about new technology, and our tactics for using AI-enabled ambient listening and documentation is one that has continuously received rave reviews from our physicians. A central factor contributing to medical errors, of course, is the high cognitive load experienced by our clinicians, rising from the need to process that vast volume of complex patient data while fulfilling the regulatory and administrative requirements with clinical documentation. Several thousands of our physicians, and now also several thousands of our nurses, have successfully used ambient listening to help them with their documentation. And hence that additional time is now used to spend more one-on-one time with patients. So what are some lessons learned? I'll begin by saying that we are incredibly fortunate to be at this moment in time in history to guide the evolution of the use of AI and automation. And there is no question that we are simply at the start. The second is that ensuring that these projects are done in a very controlled environment is critical, and that these are deployed only after extensive validation and testing, as they can also introduce new types of errors. And a lot of this has been talked about in the literature. The third is, given constrained resources, carefully identifying the projects that would make maximal and strategic impact is going to be critical. So perhaps choosing projects that already have an evidence-based protocol in place, as well as longitudinal data, and addresses an issue that is scalable in terms of solution and impact is going to be important. The last I'll say is that marrying AI algorithms built on evidence-based guidelines and protocols and integrating it to the medical record is where we're seeing significant impact, as you have the recommendations for the care teams as they interact with patients proactively or at the point of care. And I'll end by saying and stating the obvious, which is these tools are not meant to substitute physicians or care providers. They are really meant to be used as supplements so that we continue to appropriately treat our patients with empathy and pay attention to the nuances that are necessary for providing clinical care.
Well, as we wrap up, let me say that the portfolio of work that you described is great, but I've followed your career now, and at multiple places. You've been at organizations that have great strengths, but you've been doing really hard work, which is asking lots of care providers, physicians and others, to change how they work, to transform their care. And that is really challenging. So how do you personally stay resilient as you lead transformation in the very fine organizations that you work in?
Another very thoughtful question, Tom. I personally see it as a continuous PDSA cycle for myself that results in growth. In periods of significant change and complexity, I try to stay grounded by anchoring myself to purpose and values, and try to stay authentic to my own personal mission, which is to serve and inspire people. I also appreciate that transformation creates urgency, and that sustained change, as you mentioned, has considerable impact on frontline providers and really requires seeing things graciously through a long-term lens. And so in that vein, pacing change versus, focus on perpetual acceleration, I think becomes critical for both the team and the leaders that are leading change. Time away from work, whether it is through vacations, cherishing time with friends and family. I have a young daughter. And seeking advice from those who I trust also keeps me grounded. And finally, I'll say, let's not underestimate sleep and physical activity, as well as practices like meditation. I've found those personally very helpful and very important ingredients for maintaining wellness, particularly in times of stress and busyness. For emerging leaders, I'll encourage you to approach opportunities and transformation with grit and courage, and to be fearless in execution and persistent despite evolving challenges. And let's pay it forward. Let's be kind to ourselves, to others, and let's continuously and collectively strive to make the world a better place.
Well, thank you so much, Pratibha. I won't ask you what your mantra is for meditating. I can tell you that I've said some words over and over and over during my management career that probably would not qualify for sharing publicly. But you've clearly figured out a way to do this at scale and over time, which is very impressive. And I thank you so much for sharing what the work you've been doing at Mayo is like these days, but also how you've been doing this work at multiple organizations over the last few decades. Thank you so much.
Thank you, Tom.